Track 6, Chapter 1, PIP, Overview and Assessment Reform. This track is approximately 6 minutes long. Chapter 1, PIP, Overview and Assessment Reform. Chapter Summary, 50. In this chapter, we look at the potential for making changes to the PIP assessment by introducing an alternative assessment model. Introduction, the PIP assessment. 51. In Transforming Support, the Health and Disability White Paper 2023, we set out some proposals to make improvements to the assessment. These were mainly focused on the assessment process, such as improvements to our use of medical evidence and developing the capability of our assessors. 52. In this chapter, we look at the potential for making changes to the PIP assessment. PIP is over a decade old, and a lot has changed since the assessment was developed. We want to consider in more detail whether the assessment is fit for purpose. This will help us to consider whether financial support is fairly targeted and focused on people with the highest needs and additional costs. 53. At events we ran in 2021 prior to publication of Shaping Future Support, the Health and Disability Green Paper, we gathered feedback on the PIP assessment from charities, disabled people's organisations, disabled people and people with health conditions. We know that many people have a good assessment experience, but some people continue to find assessments difficult and stressful. They feel they are lengthy and repetitive and do not always trust the assessment or the decisions that they lead to. We were told that the criteria used in functional assessments may not always fully reflect how a disability or health condition impacts on daily living. Stakeholders often criticise the subjectivity of the assessment and point to high overturn rates in mandatory reconsiderations and tribunals. Disability organisations have also raised concerns about the assessment of fluctuating conditions, which they believe are not well captured by the current PIP assessment. 54. We are addressing these issues through the Health Transformation Programme, HTP, which is developing a new single health assessment service, HAS, for all benefits that use a functional health assessment and transforming the PIP service from finding out about benefits through to decisions, eligibility and payments. Therefore, we are not seeking further feedback on the experience of the assessment process as it is now. Instead, we want to consider new approaches to the basis on which an assessment is undertaken. 55. PIP currently uses what we call a functional assessment to assess entitlement for financial support. A functional assessment considers the impact that a health condition or disability has on a person's ability to function, rather than the health condition or disability itself. 56. The PIP assessment criteria were developed over a decade ago in conjunction with independent health, social care and disability experts and were designed to increase the consistency, fairness and transparency of the benefit. Early development work considered various possible ways to identify individuals with the greatest need, including assessing additional costs incurred or using existing measures of the impact of disablement. 57. At the time, the government concluded that the best approach would be to identify proxies for an individual's ability to participate in everyday life. 12 key activities which are fundamental to everyday life were chosen, to keep a strong focus on care and mobility, while also providing a more holistic assessment of the impact of a health condition or impairment on an individual's ability to participate. 58. The entitlement to PIP considers the 12 activities relating to daily living and mobility. These can be found in Annex A. The descriptors list a range of actions within each activity which people may be able to perform with or without assistance. The activities and the descriptors together make up the assessment criteria. The assessment also looks at whether someone can carry out an activity safely within a reasonable time period, repeatedly, to an acceptable standard. 59. The PIP criteria also consider an individual's ability over a 12-month period, ensuring that fluctuations are taken into account. It is essential for the assessment to accurately reflect the impact of variations in an individual's level of impairment. This is important for all health conditions and impairments, not only those which typically fluctuate. Many of the changes set out in the White Paper 2023 aim to improve our assessment of fluctuating conditions, such as the way we use medical evidence and developing the capability of our assessors. 60. Assessments for PIP are undertaken by health professionals who work for contracted assessment providers. They assess self-declared information on a person's condition and any additional medical evidence that is provided as part of a claim. They ask the claimant questions about their functional ability in a consultation, and they then produce a report for Department of Work and Pensions (DWP) case managers containing information on the claimant's circumstances and their recommendations on the assessment criteria. 61. DWP case managers use this assessment report in conjunction with any supporting evidence, including medical evidence, that may be provided by the claimant to determine eligibility for the daily living and mobility components of PIP, and whether they are paid at the standard or enhanced rate. There is currently no mandatory requirement to provide medical evidence, since the assessment considers the self-declared effect that a person's disability or health condition has on their functional ability rather than the condition itself. Each descriptor has a point score, with higher scores indicating a greater level of additional needs. The entitlement threshold for each component is 8 points for the standard rate and 12 points for the enhanced rate. Assessment based on condition. 62. We want to consider if the current functional PIP assessment is still the best way of assessing the need for ongoing additional financial support towards the extra cost relating to a health condition or disability, or whether we should consider a new or hybrid approach based entirely or partly on the diagnosis given to an individual. 63. There are many thousands of unique medical conditions, and with each one the effect on the individual diagnosed will vary significantly. Many health conditions and disabilities fluctuate and change over time, impacting on a person's ability to function in different ways at different times. We need to understand how we would choose the conditions that would be eligible for support, whether this approach would be fair, and if it would help us ensure support goes to people with the highest needs and those who have extra costs associated with their condition. 64. We want to understand if evidence of a clinical diagnosis made by a healthcare professional could provide a more objective assessment of need than the current functional assessment. This would mean that people could receive entitlement to PIP based on specific health conditions or disability, evidenced by a healthcare professional without undergoing an assessment. Some other countries, such as the United States, have a model of disability support that places more emphasis on a list of prescribed conditions. In comparison, the current PIP eligibility is based on an assessment of functional needs with no mandatory requirement for evidence of a specific health condition or disability provided by healthcare providers. Further details on these international models of disability support can be found in Annex B. 65. We want to understand how we could account for the variation in the severity of the disability or health conditions and the effect on the individual if we move to a full or hybrid condition-based approach. We also want to understand how claimants could provide clinical evidence for this approach. 66. We think an assessment based on condition would require a greater emphasis on the provision of medical evidence of a diagnosis, and we would need to consider the requirement this would place on the NHS and health professionals. We have committed across government to reduce administrative burdens on general practice. We would need to carefully consider how to ensure this approach would be fair and whether it would be the best use of resource. 67. Currently, people are encouraged to send their own evidence such as hospital letters or care plans to support their claim. If further evidence is needed, the assessment provider contacts the GP or hospital via a form for further information, but this form is often not returned or contains limited information. With improved digitalisation of the NHS, it now often shares hospital letters by post or through online services with patients, and people now have access to their own health records through the NHS app. We would like to know if this access to documentation could be used better as evidence of a health condition or disability to support the assessment for eligibility for PIP. Chapter 1. Consultation Questions. Question 1. What are your views on an assessment that places more emphasis on condition rather than the functional impact of a condition on the person? Question 2. What are your views on people receiving PIP without an assessment if they have specific health conditions or a disability as evidenced by a healthcare professional? Question 3. What are your views on PIP claimants not being subject to an award review if they have a specific health condition or disability as evidenced by a healthcare professional? Question 4. Do you agree or disagree on making provision of evidence or a formal diagnosis by a medical expert a mandatory requirement for eligibility for PIP? Agree. Disagree. Don't know. Question 5. In relation to question 4, please explain your answer and provide evidence or your opinion to support further development of our approach. Question 6. How could we prevent the provision of evidence or a formal diagnosis by a medical expert from impacting the NHS? Please explain your answer and provide evidence or your opinion to support further development of our approach. Question 7. Do you agree or disagree that eligibility for PIP should be based more on condition? Agree. Disagree. Don't know. Question 8. How could we determine eligibility for the following conditions? Conditions that fluctuate. Conditions that vary in severity. Conditions that might be cured or have access to better new novel treatments over time. Please explain your answer and provide evidence or your opinion to support further development in our approach. This concludes Track 6.